Okay, today we'll be talking about oral care, the importance of oral care in older adults. So our learning objectives are understand the importance of mouth care in the elder population, have basic knowledge on how to assess the mouth and when to seek help, have basic knowledge on how to assist an elderly person with brushing, flossing, and denture care, and the last one is have basic knowledge on how to perform mouth care in patients that have dementia or NPO, which is nothing by mouth, or are unconscious. Okay, why is mouth care important? So mouth care is important because as people age, there's many changes in the mouth. Some of these include changes in biting mechanics and teeth grinding / clenching. This can reduce chewing ability and increase the risk of further tooth loss. So as many as 78% of the elderly population have edentulism, which is teeth loss. This can impact other organs and quality of life. Caries are the most frequent dental pathology in elders due to salivary changes related to aging, dry mouth, poor diet, and gum recession. So dry mouth can lead to infections or cavities and is caused by medication use. It can be blood pressure medications, antidepressants, anti-anxiety medications, antihistamines, and decongestants. And as we know, the elderly population often have a lot of different kind of medications. So it can also be caused by radiation or chemotherapy, dehydration, certain diseases like diabetes, salivary gland dysfunction, and smoking. So elders are at high risk of gum disease, and when left untreated could lead to painful chewing and loss of teeth. So gum disease can even increase the risk of heart attack and stroke by releasing toxins in the blood. And this shows that having poor mouth care can really affect the mouth, not only the mouth, but also the organs and the overall health of the elder. So mouth care contributes to the prevention of lung infections due to dysphagia. Pneumonia is a common lung infection that can be caused by the inhalation of certain bacteria, which can accumulate in the mouth when not cleaned properly. Poor oral health can decrease self-esteem due to avoidance of social activities. So for an elder, going to a restaurant with friends might be something that's very important for them, and they might not want to do this because they have problems chewing. Avoiding foods due to dental pathology is also seen in elders, which could lead to lack of nutrients, which in turn can cause diseases like diabetes, cardiovascular diseases, anorexia, and frailty. As we know, nutrition has a big impact on overall health. So many studies state that compromised oral health correlates with lower quality of life. In a study which included educating patients and or caregivers on dental care, 6 months later, the group who had received education had a significant reduction in the number of teeth with plaque and improvements in the cleanliness of dentures. So dental health is often neglected in the elderly due to the elderly having large amounts of comorbidities that are prioritized over mouth care. So it's very important to prioritize mouth care. Okay, how to perform oral care on older adults. So you want to routinely assess the patient's mouth to look for any differences. Stand beside the patient to ensure that the patient can see you, so it's not a threatening position. Let the patient sit in front of the sink. Check in with the patient regularly throughout the process to ensure that you are not brushing too hard or causing them any pain. Brush teeth twice a day using a soft bristle toothbrush for 2 to 3 minutes. Brush at a 45-degree angle to their teeth. Use gentle circles and do not scrub, since this could damage their gums. Brush your tongue and every single surface of every tooth. Assist with the person to rinse out their mouth with warm water once the cleaning is complete. Ensure that the patient is receiving regular dental checkups. So this will depend on the individual, and your dentist can educate you on this. So in our handout that we made, there's a step-by-step guide on how to brush your teeth, basically, with some pictures on there. Okay, next is denture care. So routinely assess gums and proper fitting of dentures. Place a towel at the bottom of the sink. This is to prevent the dentures from breaking if you drop them, because dentures can be quite expensive. Remove dentures daily to allow for cleaning and the gums to rest. Clean the dentures every day like you would with normal teeth after each meal and before going to bed. Once dentures are removed, brush the remaining teeth, gums, and roof of mouth, carefully using a soft bristle toothbrush. Floss between the remaining teeth. You can soak your dentures overnight, either in warm water with a denture cleaner or mix warm water and vinegar and let them soak overnight like that. It is preferred for the patient to remove their own dentures, but if they are unable to do so, gently remove the dentures by applying forward pressure to the back of the denture with a gloved finger. If brushing the teeth is causing pain, you can run it under warm water or use a finger wrapped in a clean damp cloth. If patient needs assistance with putting dentures back in, apply adhesive to dentures as per patient's preference and moisten dentures before reapplying them. Ensure that the dentures feel comfortable for the patient. So flossing. It is important to floss at least once a day, since without flossing, a third of the tooth surface is not being cleaned. Using classic dental floss with a plastic handle, slide the floss between the teeth around the base of the tooth and under the gum line. Repeat on every single tooth using a new part of the floss for each tooth. Okay, so on our handout, we also included a section on how to floss with step-by-step, and then also on denture care with some tips in there too.
Okay, so some modifications made for seniors. Double-headed toothbrush and electric toothbrushes. They can be helpful to remove extra plaque if the elder has reduced dexterity. Making the handle of the toothbrush longer, wider, or adding an acrylic mold to the adult's grip may make it easier for the adult. Flossing may be difficult for the elderly patient, and a plastic floss holder may ease this difficulty. Creating a mouth care plan for seniors can be difficult on your own, so reaching out to local dentists in the area can help create a personalized plan that is appropriate for your caregiver and elder. So here are just pictures of local dentists in Brandon. And Manitoba also has a provincial program that provides free or subsidized dental care to certain populations like seniors, and you can visit this website for more information. So some tips to provide oral care for patients with dementia. It is important to find a routine that is familiar to the patient, so brushing your teeth at the same time of day and in the same place. Help with labeling of the oral care tools with names, colors, and placing them in familiar places. It's important to be prepared to provide more time and prompts to orient the patient. Encourage the patient to do as much as they can on their own. Use a toothpaste that doesn't foam if the person has difficulty swallowing. Mouthwash can be used if the patient is distressed with brushing, but it is not a replacement. The dentist may prescribe a high-strength fluoride toothpaste or a fluoride mouthwash for a patient that may be struggling to keep up with their brushing. Provide short, simple instructions. Use the watch me method or the tell, show, do. So the watch me method is hold the toothbrush and show the person how to brush their teeth. And the tell, show, do is tell the person what you're doing, show them how they're going to do it, and then ask them to do the steps the same way you explained it. Look for physical signs of tooth or mouth pain. So that can include the person refusing to eat, facial expressions, wincing or looking uncomfortable. And lastly, it's important to put yourself in their shoes and praise them when they're doing well with things. And some of those tips are also included on the bottom of our handout here for dementia patients and modifications. So how to perform mouth care on unconscious, end of life, or patients that are not taking anything by mouth. So position the patient in side lying position with the head of the bed elevated at 30 degrees to allow secretions to drain. You can use a tongue blade to depress the tongue. Never put your finger in a patient's mouth to try to force open their mouth, as this can be very dangerous for the caregiver, and the patient's reflex will be to bite down. Clean the mouth using a toothette with mouthwash. Follow the same steps as previously mentioned when it comes to cleaning the areas of the mouth. And finally, apply a water-soluble moisturizer to the lips. So end-of-life patients or unconscious patients are at high risk of drying of the mucous membranes, thickened secretions, and they also have an inability to eat or drink. So they're at risk for infection and aspiration due to a reduced gag reflex and pooling of the saliva. And they can require mouth care up to every 2 to 3 hours. And patients that are MPO or not taking anything by mouth, it is still extremely important to provide mouth care due to them being more likely to have excess drying and fragility of the mouth and lips. It is important to ensure that the patient is not swallowing any fluids during mouth care, so a toothette dipped in mouthwash is a perfect solution for this. And lastly, we have a slide on how to recognize signs of poor oral hygiene. So it's important to know your mouth or know the mouth of the person that you're taking care of. So healthy gums should be pink, firm, and free of pain. If you notice that they're red, bleeding, or painful, it's important to see a dentist. Healthy teeth should be free of cavities, clean, firm, intact, and causing no pain. So loose or chipped teeth or teeth that are causing pain, you should see a dentist as bacteria can get in there. And a healthy tongue should be pink, smooth, moist, and again, not cause any pain. Uneven, red, dry, painful, white, red, speckled patches or lumps that stay on your tongue for 2 weeks are not normal, and you should be seeing a dentist. It is also really important to know if the dentures are fitting properly, as poor fitting dentures can create low self-esteem and barriers to receiving good nutrition. Well-fitting dentures should be comfortable, help you talk, chew, and help you smile, not causing pain or swelling, loose, or affecting the way you talk. So lastly, we just have some practice questions for the audience. So first, dry mouth is caused by all of the following except A, blood pressure medications, B, smoking, C, chewing sugar-free gum, D, radiation and chemotherapy, and E, dehydration. So the answer is C, chewing sugar-free gum. This is actually a way to help with treating dry mouth. And question number 2, older adults should brush their teeth twice a day for at least 2 to 3 minutes. And this is also true, which we discussed previous in our slides. And this is just a list of our references that we use on our PowerPoint.